Okay, welcome back to another atrial dysrhythmia video. In this video, we're going to walk through a couple examples, so hopefully you can see how the step-by-step interpretation leads to your final EKG interpretation diagnosis. So here's our first rhythm here. Okay, let me make sure I'm ready. Okay, so if we start off looking at our rate, what is our looking at our regularity. Is it regular? So if I look at my R to R interval here to here and then here to here, just visually right away, I can tell that this is not regular. So this is irregular. So this is something I'm going to make note of. This is irregular. I already don't like it. Now I could go through and measure those individually. This one is 15 small boxes. This one here is about 5, 10, 15, 16. So I guess not too different, but this one here, 5, 10, 15, 18, 19. So we do have significant variation in our R to R interval. So it is an irregular rhythm. Now, what is our P waves? Do I have P waves? So for P waves, I'm looking right here before the QRS. I'm looking for something that is one perfect round upright hump. Is that maybe a P wave? I don't know. It's one hump. But if I look at most of these, I do not see definitive P waves. So I'm going to say no. I don't see P waves. In fact, what I see, if I were to draw it, right, what I see is an irregular squiggle. It's something that a 6-year-old could draw. So for me, I'm going to say this is a potential lowercase f wave, potential fib wave. Do I see T waves? I do. I do see some T waves here. So we do see some T waves. They're not all uniform, but they are upright when they are present. So I'm going to say that's an okay looking T wave for now. Now, what is my atrial rate? Well, since I don't have P waves, it's going to be really hard to calculate an atrial rate. But if I pick any one of these kind of spaces in between QRS complexes and I look at, here's potentially one waveform right there, one waveform right here, well, that waveform starts and ends in less than one small box, and so does the one right next to it right there. So even if I tried to count each hump, I know that my atrial rate is going to be above 300 using that rule of 300 method. And my ventricular rate, because it's an irregular rhythm, I'm going to count using the 6-second method. So I've got 1, 2, 3, 4, 5, 6, 7, 8, 9 QRS complexes, so my ventricular rate is about 90. Remember, using the 6-second method is ideal for irregular rhythms. What is my PR interval? Can't measure. Unable to measure because I don't have good P waves. What is my ST segment? So here it is hard because not every T wave is uniform, but where I do see definitive T waves, it is pretty in line with that PR segment right beforehand. So that is nice and normal. What is my QRS duration? So I can find any one of these complexes to measure since they're all approximately the same. So here, if I look at this QRS, I would say it starts right there on that small light colored line and it finishes right here. There's my J point right there on that next line. So at most, at absolutely most, this would be 0.012. So I'm going to call that normal, good normal QRS. What's my P to QRS ratio? Well, I said I don't have any P waves, so therefore I have too many QRSs. So QRS here is the excess, which is not normal. Do I have artifact? No, it looks pretty okay. So if I identify what I have abnormal, it's irregular, I don't have P waves, I have extra QRSs, my atrial rate is super fast. So if I put all of those different pieces together, I'm going to come up with a diagnosis of atrial fibrillation. Good? All right, if we look at our next strip here, our next dysrhythmia, so we're going to go through those same 6 steps. Is it regular? Again, no, my eyes tell me that my R to R intervals are not the same. So here I've got maybe about 11 small boxes in between, and here I've got 10, maybe about 14. Here I've only got about 8. So no, this is not a regular rhythm. Do I have P waves? Yes. Yes, I do. There's a beautiful P wave. There's a beautiful P wave. So we see lots of uniform identifiable P waves. Now, I might not have a P wave here with these 2 complexes. So, and one down here as well. So those ones definitely don't have the same morphology P waves as the ones that I'm seeing throughout most of the rest of the rhythm. So I would say most P waves are good. Most P waves are upright. But I potentially have some P prime waves in there, some P waves that look different, or you might call it a TP wave because you can only really see one bump in between those QRS complexes. So maybe that P wave has kind of merged and fused with the T wave before it. Do I have T waves? I do. Yes, I do. And they are upright, so T waves look great. So what is my atrial rate here? So on this rhythm, since I do have P waves, I can use the 6-second method to calculate my atrial rate. I've got 1, 2, I'm not sure, 3, 4, 5, 6, 7, not sure, 8, 9, not sure, 10 P waves at least. So we're going to say at least 100. It might actually be more because if I look closely here at this complex, I see a little hump there. And if I compare this T wave here to this T wave here, it looks different in shape. So to me, that really kind of gives me enough data to support there being P waves in there. Your T wave shouldn't change shape. There's no need for it to, unless it has absorbed a P wave in addition. So I'm going to potentially say it's somewhere between 100 to 130. And if I calculate my ventricular rate, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 12, 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12. Oh, that makes sense because the next one's going to be right here. It's going to be 120 using the 6-second strip method. So PR interval here. On this one, we have at least 2 variations of P waves. We have clear identifiable P waves, and then we have maybe P prime waves / TP fused waves. So we're going to measure our PR interval using the normal. When you have a majority, which we do here, most of our P waves are normal and are upright, and they all look to be about the same spacing from your QRS complex, you're going to use any one of those normal ones to measure your PR interval. So this guy starts almost right there on that dark line, and he finishes right about there. So I would say this is normal, about 0.12. So your PR interval is good. Now you can always double check yourself and calculate a few just to make sure you're not missing something just with your naked eye, but with training you'll kind of get a feel for when you should be measuring. Your ST segment here, it looks pretty good. So I could take my ruler, I could draw a nice straight line from my PR segment to my ST segment, so there's no elevation, no depression. My QRS duration. So this looks narrow. It looks narrow. I would probably want to zoom in to really get a good measure on this, but really narrow is good. Narrow is healthy. So again, if I start measuring here on this dark line right where I ended my last PR segment, my J point is going to be right there. And so my J point is going to be about 2 boxes away. So 0.08. Normal. P to QRS ratio. So this one, I think you could make an argument that you have more QRSs just at where you're at in your education. I just told you why I would say it's 1-to-1. So I think that these kind of abnormal waveforms here, where we have the narrowest R to R interval, I think that's a TP fused wave. So I would say we have a 1-to-1 ratio. You could make an argument that you have extra QRSs if you wanted to, but I wouldn't. I wouldn't go that route. Is there artifact? No, this is a nice clean EKG. This is definitely an EKG you could use for interpretation. So what have we identified as abnormal? Rate is fast. That means we're looking for an interpretation that has tachycardia in the answer. Regularity is irregular. And we have potentially 2 different kinds of P waves. So when I put those 3 abnormal pieces of information together, you find out that you have sinus tachycardia with some premature atrial complexes. So it's a tachycardic rhythm, mostly being controlled by that SA node because we have lots of good perfect upright P waves. But we have some abnormal beats thrown in there as well. So we have some PACs. All right, let's look at our next rhythm here. So if we look at regularity again, oh my goodness, this is another irregular rhythm. So if I counted how many boxes between here, 5, 10, 15, 20, 25, almost 30 boxes between that R to R interval. And here I only have maybe about 17. So this is not a regular rhythm. Do I have P waves? Maybe. Yeah, I think that's a P wave. I think that's a P wave. And that might be an inverted P wave. Ooh, this one does not have a P wave. This one I don't think has a P wave either. So, question mark. If I were to say P waves are present, I have at least 1. I'd say these 2 look the same. 2, and then a lack of P waves. This would be potentially 3 varieties. 3 varieties of P waves. Do I have T waves? No, I don't. Remember, T waves don't change your interpretation. It's just something to keep note of for now. You'll get more into that with your 12 lead class. What's my atrial rate? Well, I only know for sure 1, 2, 3 for sure atrial rate. So my atrial rate is only 30. My ventricular rate, 1, 2, 3, 4, 5. That's the end of one. So you might include it, might not. I'll just split the difference and call it 55. My PR interval. So if I look at these two that I can measure, I could probably measure that as normal-ish. Looks like about maybe 0.16, maybe 0.20. I could probably measure this guy as well. Comes out about the same. 0.16 would be my measurement. This one looks a little bit further away. There we go. So that one might be a little bit abnormal. Because we have variations, so many variations in P waves, I would say unable to measure. Too many variations in the P waves. Wouldn't waste my time measuring it. Well, we don't even have T waves, so it's hard to say where's the ST segment. But if you really compare this baseline, here's our potential PR segment to our potential ST segment. It is on the same horizontal, so ST segment looks okay for now. QRS duration, all the QRSs look the same, so you could measure that any one that you like. If I take this one here, it starts right about on that line and finishes almost on this dark line. So it's right at about maybe 0.11, maybe 0.12. Hard to tell with the naked eye, I would say. Good enough for government work. This is a nice, normal, narrow QRS complex. Our P to QRS ratio, we already calculated. We have too many QRS complexes. An artifact? Not really. Not really. This is a pretty flat baseline, so there is no artifact, so that's good. So what do we have abnormal? We have an irregular irregular rhythm that is too slow with too many different kinds of P waves. So when we're talking about 3 or more different variations in P waves, you should be thinking wandering atrial pacemaker. So we have too many sites of the heart trying to control this rhythm. All right, here's our 4th practice rhythm. So if we go through these steps again, is it regular? So at first glance, yes, I think it's regular. I think this looks great. It looks like a metronome. I can always double check my work. So let's count some small boxes. I've got 5, 10, 15 plus 4, 19, 20, 21 small boxes here. Let's check the next one. 5, 10, 15, 20 plus another 1. Sure, 21. Almost 5, so 4, 5, 10, 15, another. Yep, so they're all within 2 small boxes. So this does check out. It's a regular rhythm. Remember, you want to try and train your brain to look at regularity quickly at a distance and then zoom in just to check your work. Do I have P waves? So if I look before every QRS, do I have P waves? They're definitely not round and upright and perfect. Not what I expect. In fact, I would say it looks like this. So I would call this a capital F wave, a flutter wave. It looks like a sawtooth. There's some symmetry to it. It has pointiness to it. It is kind of wide and unexpected. That meets our definition for flutter waves. Do I have T waves? No. Hard to see, but we expect that if we are potentially calling this a flutter. So let's just check it out and make sure we finish the rest of our steps. What's our rate, our atrial rate? So each one of these flutter waves counts towards your rate. So if I'm looking here from one flutter wave, you can choose any part on the flutter wave to the same part on the next flutter wave to kind of measure how much the rate is. And for this, I would use my rule of 300. So I just kind of picked the bottom peak of a flutter wave, 2 flutter waves there, and they are one large box apart. So remember, using your rule of 300, your first large box apart, your atrial rate here is about 300. Might be a little slower. Our ventricular rate. So this one, because it's a regular rhythm, we could do the 6-second method and come up with 1, 2, 3, 4, 5, 6, 70, a rate of 70. Nice, quick, and easy. Or we could get a little bit more accurate and do some math. And we would get, let's see, where's a good one to start with? This one's good. So this is 5, 10, 15, 20, 21. Well, we already did that. 21 small boxes. So you would take 1,500 divided by 21. And I think you would come out somewhere about 72, 73 beats per minute. So not far off from using the 6-second method, just a tiny bit more accurate. What is our P to R interval? Well, if we're calling it an F wave, we don't measure a P to R interval because we don't really have a P wave to measure. Can't see our T wave, so we can't see our ST segment, so we'll just ignore that. But our QRS, we want to double check that that's normal. So here, if I look at this guy, his J point is right on this dark line. And it looks like he starts right about that, light line right there. And so this is definitely less than 3 small boxes. I would say it's closer to 0.08, but that's normal. We have, in this case, too many F waves, right? Too many F waves. So we have more atrial conduction than we have ventricular conduction. We do not have any artifact, so that's nice and normal. So what have we identified as abnormal? We have flutter waves. We have a fast atrial rate with a regular ventricular response. When we put all of those pieces together, this is an atrial flutter. Now, because this is a very regular atrial flutter, you could go one extra step here and count how many flutter waves before each QRS. So there's 1, there's 2, there's 3, there's 4 QRS. 1, 2, 3, 4 QRS. So you could call this an atrial flutter with a 4-to-1 conduction ratio, meaning for every 4 atrial contractions, there is 1 ventricular contraction. You can only use a ratio if it is consistent, if it is a regular rhythm with the same ratio of Fs to QRSs every single time. Right, we got one more practice, I think, to do together. A couple more. All right, so here's this one. This one, first glance, looks regular. Everything looks to me from first glance to march out, and if you just kind of look, they're all about 10 small boxes apart. What's our atrial rate? So do I have P waves? I mean, I've got some kind of hump. Maybe P waves. They don't look beautiful and perfect, but also maybe they're there. What's my ventricular rate though? So that I can calculate. And again, with super fast rhythms, instead of counting 1, 2, 3, 4, 5, I would use the rule of 300 on this one. So this one starts right here on the dark line. So if the next one was here, that would be 300, but the next one is on this dark line. So your ventricular rate is about 150. And you could verify that again, any method that you want to. Your PR interval, if you're calling this a P wave, you could measure it out and it would be below 0.20, so it would check out as normal. Your ST segment looks just slightly below your PR segment, but remember, it has to be a full box above or below for it to be significant. So our ST segment looks good. Our T waves, so after the QRS, we do have, so what we have here, QRS, we actually have kind of that thing happening. So our T waves are inverted. Remember, that doesn't change your rhythm. It's just something to start training your eyes for. So our T waves are inverted, so that's another just abnormal finding there. Our QRS duration, though, let's see what we can measure. This one looks good. Starts right here on this dark line, and our J point is right here, so that's about 0.08, so that checks out. Our P to QRS ratio, if you're calling that a P wave, I would say that you do have that before every QRS, so I would say it's good. I would say it's a 1-to-1, which means that you would calculate your atrial rate out at the exact same 150 beats per minute. And this rhythm does not have any artifact. It's a pretty clean interpretation. So the only thing that you have abnormal here is it's very, very fast. Very, very fast, and then you have inverted T waves as well. So you could call this a sinus tachycardia, and I would accept that answer. You could also just call this your generic umbrella term of a narrow complex tachycardia or a supraventricular tachycardia, because you're not 100% sure those are P waves that you see between each QRS complex. So if you're not 100% sure, if it doesn't look perfect, upright, positive, beautiful sinus P wave, you can call it you could just call it an atrial tachycardia. If you are definitive, that is a P wave, that is a sinus P wave, you could call it a sinus tachycardia. So that's really why this term was developed, narrow complex tachycardia or supraventricular tachycardia, for these rhythms that are really hard to kind of pick up on. And you'll get used to kind of figuring out which way it goes. It also helps to have a patient in front of you to look at these. So you get used to which ones are sinus and don't need treatment versus which ones might be atrial and do need treatment. And that was our last practice strip. So hopefully that helps you go through these steps and put all the pieces together as you are practicing on your own. Have a great day.